As an organisation, Western Health is really embedded in the community of the West of Melbourne, and our volunteers are here to support us to think about how we meet the healthcare needs, specifically within our region.
There's a real myriad of people who come to us to be volunteers because they see it as something that's really worthwhile and they can see that they are supported here. One of the things that staff sometimes may struggle with is the whole philosophy of volunteering. The concept of people coming in and giving their time for free can be quite difficult for people to understand, that someone would come and do that and not have any financial reward. So the whole idea or the whole concept of volunteering can be quite strange.
Volunteers work hand in hand with the medical and nursing staff. They provide support, empathy, friendship. They actually provide the clients with a normal time in their very stressful hospital admission.
Having someone there to talk to and to tell their story to is something that the patients seem to really enjoy.
A woman just stopped me before. She said, "You were so kind to my daughter in emergency. Thank you, June, very much for what you've done."
Without people volunteering and helping, this hospital wouldn't be where it is today. Everyone would be all over the place looking for things. We help and make a difference.
The school engagement program is something that sits really well with Western Health Volunteer Program. We've got over 200 students aged from grade 4 up to 18 and 19-year-olds learning about what's happening, understanding what the staff do, actively engage with coming into their local health service, wanting to contribute.
It's a good experience. You learn a lot of new things. You talk to a lot of new people with different cultures.
Our main values are to do with respect and responsibility and valuing relationships. So extending that to become a volunteer just made a lot of sense.
It gives them that encouragement to engage with people outside of school in the way that they would have to if they were going into interviews and if they were going into workplaces for the first time.
The volunteers are in the blue vests are visitor guides and their focus is purely on wayfinding. The purple vests are all the rest of our team, so that involves our auxiliaries, our opportunity shops, social support and our community engagement.
A great example about how diverse the contribution of volunteers is the garden we have in our secure unit with patients with really high needs. Volunteers raised the funds, volunteers designed and implemented the garden. Our specialist volunteers support patients utilising the garden and understanding and thinking about being outside. And our really young local school volunteers have contributed really fantastic artwork.
I think volunteers add tremendous value to Western Health. A lot of things that they do, I think, go unseen and unrecognised.
They bring something that I don't think we as staff can necessarily bring. We're so focused working with patients and families on the clinical aspect of their care. We don't have the time to offer patients and families other components to their care.
I think it's really important that staff know what volunteers can do and what their role is during the patient's journey. So it's important firstly not to see them as a deterrent or an obstruction through your daily tasks on the ward.
We're here to help out and to assist them when they need and to entertain the patients, have a chat.
More than anything else, a volunteer brings life experience.
So on a day-to-day basis that might be assisting with some administration tasks, it might be assisting with doing some patient support on the wards.
Volunteers coming in has a huge impact on our staff. It frees them up to do the things that they have to do, and it really adds another dimension to the clinical team. They can work with us to deliver care, but they do it in a different way.
Their contribution to the patient experience, I think they add that extra level of care.
We're looking to staff to be able to let the volunteers know and be quite directive about what they could do to help the staff member improve their day.
If you work as one, it helps everyone. It helps the staff, it helps the volunteer and it helps the patient.
I think it's really important to catch up with the volunteers when they hit the ward and take that extra 5 minutes to have a chat to them to see what areas they can help you in terms of how the ward's running.
If there was a feedback register that the nurses had that said, okay, bed number 27, up for a chat, so the volunteers could concentrate on those people.
With them saying good morning and thank you, it makes us feel happy and valued.
I think at the end of the day, all of us just want to be thanked. That sort of acknowledgement goes to the heart of volunteering.
We work with volunteers and they need to be completing something that brings them satisfaction.
They want to come in, have an impact, feel good about it and then leave your ward or leave your workspace with you saying, thanks for that, you really made my day. Thanks for that, you really supported that patient really well. Thanks for that, it's great to have you as part of our team.
The value that we provide, the patients are better off as a consequence. And I think that's what we're all on about, providing better patient care.
Working together as a team, not just nurses, the doctors, volunteers, it's a group effort to ensure that we provide good care to our patients.
As far as volunteer recruitment goes, we never ever have to advertise. We have people who come and want to be and want to give. And I think that that's something that says a lot about who we are and how our community see us.
Our volunteers are really part of who we are. They're part of the fabric of the organisation. They say to us and to the community that valuing what our community believes, how our community responds to us, and really how we respond to the community at that genuine interface level. The volunteers support patients to move around the organisation, support them at meal times, support patients and staff to think about how to manage getting through an anxious period in outpatients or as they come in through surgery procedures. All of that is part of really trying to provide patients with a more friendly, a more open way of interacting with the organisation.